I'm Asalap and I'm going to discuss Unit 18 Health Promotion. What is health promotion? Health promotion is a process which enables a person to have increasing control over and to improve their health. The World Health Organization describes as health as a condition of complete physical, mental, and social well-being rather than a mere absence of disease or infirmary. Good health is not determined by a single variation or factors such as social and environmental. Economic state have an impact on health as it can make easier or more difficult for individuals to make change their health and access services. In England, Wales, Scotland, and Northern Ireland, health promotion can vary based on strategies in place and their aims. But all key principles focus on promoting good health and individual control on their health. Campaign focus on areas such as mental health and well-being, diet, obesity and physical exercise, smoking and alcohol, drugs, HIV, and sexual health. Health promotion useful tool is beneficial in being able to reduce the pressure on the NHS, which can be treated by themselves through buying over-the-counter medication at a pharmacy for their minor diseases, to encourage people to take a flu vaccine, which then reduce the rate of sick people in hospitals relating to influenza, reduced and diseases avoided by using the correct precaution and preventative measures. The campaign was split in four stages: alert, educating families on the danger of excessive sugar consumption and making message personalized; motive, encouraging parents to take charge of their child's diet; support, encouraging parents to download the new Sugar Smart app within the Change for Life program, which provided families with free assistance; sustain, making sure children are eating less amount of sugar and cutting the amount of sugar in breakfast, as well as reducing the amount in sugar in drinks, as these were two main sources of high consumption of sugar. Childhood obesity rates were increasing at worrying rates, and therefore Change for Life was launched in 2009. It was the primary national marketing movement to tackle obesity and the health issues causing it. The primary purpose of this campaign was for prevention, and the demographics of this campaign were for between the age of 5 to 11. Moreover, it was aimed at families as parental attitudes and behavior suggested that children were at high risk of becoming obese. 2.6 million people downloading the apps linked to the campaign. Change for Life shows how individuals, including family and children, will be able to positively benefit from this campaign. 74% of mothers reported an increase in concerns to the amount of sugar consumed by their children. 3 in 10 mothers reported that they reduced the amount of sugar for their children consumed. 8 out of 10 people who used the app linked to the campaign on a frequent basis used the scanning facility of food items. Good Health is another leading initiative for Public Health England and was launched in 2020 with the slogan "Let's do this." This slogan was meant to encourage those who had been inactive due to the subsequent lockdowns that was announced in the UK. The campaign has four primary goals: lose weight. Obesity were increasing and because of underlying health conditions such as type 2 diabetes, serious hospitalization because of pandemic were on the rise. Therefore, adults were encouraged to lose weight if they were obese. Quit smoking. Encourage people to quit smoking. Better Health revealed the fact that if an individual made it 28 days without smoking, they were 5 times more likely to quit. Drink less. Encouraged to reduce the amount of strength of alcohol, as well as setting up budget to stop overdrinking in social spaces with families and friends. Better Health use for apps to support and encourage individuals with their goals to becoming healthier. NHS Weight Loss Plan app. NHS Quit Smoking up, Couch to 5K up, Drink-free days up. Better Health has had mixed reaction on its way of encouraging health promotion and the timing of its launch. However, it was successful. Numerous organizations such as the British Heart Foundation and Age UK share this campaign on their platforms. Around 6 million adults aged 40 to 60 are thought to be eating healthier. 39% of adults are losing weight. 4 in 10 regular smokers plan to quit. 43% in individuals in January felt more motivated in making positive health changes in their life. Change for Life campaign reaches 99% of targeted families. 413,466 families joined Change for Life in the first 12 months. Over 44,833 families were believed to still be involved with Change for Life after 6 months. Over 1.9 million responded online. Face-to-face telephone were received in year on. Impact of the campaign: a decreased risk of common cancers such as pancreas and liver cancer, lower risk in increased blood pressure, lower risk of developing diabetes, reduced risk heart disease, less strain from chronic joint and back pains, reduced risk serious hospitalization because of COVID-19. This campaign has not only been able to reduce the risk of serious hospitalization and needs for support in intensive care units because of COVID-19, but it has also been able to reduce the serious disease and condition through its four common aims: getting active, losing weight, quitting smoking, and reducing drinking. The UK government has set a target for England to be smoke-free by 2030. 2034 in Wales, Scotland, and Northern Ireland. This means reaching a stage where less than 5% of population smoke in less than 7 years. The campaign has 12 recommendations which they have put to the government. Legislate to make tobacco manufacturer pay for smoke-free 2030, to take place on the world stage a global leader in tobacco control, set their targets for 2025 and update strategies if they are not on track of smoke-free by 2030. Deliver anti-smoking behavior, make changes campaign that targets unemployed smoker, ensuring all smokers are advised to quit at least yearly and give them an opt-out referral to stop smoke services. Give additional support and help to those living social housing or mental health with condition who have a high rate of smoking. Ensure all pregnant smokers are given financial incentive to quit. In addition, smoking cessation help. Fund regional programs to lessen the use of illicit tobacco in deprived communities. Legislate to put health warnings and quit messages on individual packets of cigarettes and close other loopholes in existing regulation. Reduce the availability appeal of e-cigarettes to children. Make the routes of medical licensing fit for purpose to allow e-cigarette to be authorized for NHS prescription. Consult on raising the age limit from 18 to 21 for selling tobacco. 5 action areas in health promotion. Building healthy public policy is the process of developing policy that supporting health by not only protects the health individually and community, but also making it easier for person making healthy choices. For instance, population requiring to wear seat belts, helmets, smoking restriction, and workplace health and safety regulation. Creating supportive environment. This focuses the aims of to increasing promoting the ability of people to make healthier choices and their community where they live, work, learn, and play. Strengthening community action refers to the collection of effect of community to improve community fund run that promoting population to be active. Community kitchen that promotes healthier eating, and community-based organization that supporting people living with HIV and STR are all community efforts to improve health. Reorientating health services aims in making health system focus more on supporting the needs of population and community for a healthier lifestyle. For instance, train doctors to assess and educate patients to stop smoking and establishing health educator rules within medical center aligning preventative activities and improving access to health for culturally and linguistically diverse population. Lastly, developing personal skills focus on supporting personal and social development done by providing information, education training life skills to make positive health choice. Example, online program providing information on heart illness, illness, distributing educational materials on the impact of diabetes, as well as classes that teach population on how to manage illnesses. The three strategies for health promotion, such as health communication using combination of social and individual action in obtaining political commitment, policy support, and social system that support a health goal. Health education to process by which different interests of community and individuals, as well as different sectors such as public or private, are settled in ways that protect and promote health. Policies, system, and environmental change, health promotion action that improves health that are taken in partnership with individuals so that they're empowered to take action to promote and protect their health. Evaluation techniques that could be used are global-based evaluation, can be done at regular, agreed upon interval, or at the end of the campaign. The health promotion campaign would set SMART targets, specific, measurable, attainable, relevant, and timely, and would measure any progress made towards these targets. This evaluation will be beneficial in presenting reports to stakeholders as it delivers the information that was agreed upon the start of the program. Process evaluation data generates and will be helpful to identify inadequacies within the campaign and will enable a streamlining process to begin, as well as be able to portray the program's status to external parties. Impact result evaluation is useful for measuring sustained changes brought about by making changes, modification to policies and the campaign overall, as it is focused on the long term. I would primarily use these both methodologies, strategies, which are crucial to gaining insight on the effectiveness of the campaign. I would have to determine how best examine data and interpret the outcomes, and then further break down the data to re-examine the health promotion after the campaign has completed. I will promote mental health awareness with focus on anxiety. 2023 World Mental Health Day is another opportunity talking about mental health in general, how important, how we need looking after ourselves, as well as talking about things and getting help if person is stressed and struggling. Mental health problem existing in our lives, families, workplaces, and society affects all. Furthermore, making sure that mental health is treated equally with physical health. This would prevent preventing mental health each and as a society and continue to call on local government to practicing reducing factors known posing risk of posing risk to health persons' mental health, enhance those known to protect, as well as creating the condition required for individual to thrive. When choosing how to promote this health campaign, it is essential to consider 7.6 million people in the UK are living with heart or circulatory related illnesses, and 1 in 4 people have experienced mental health issues at least once in a year. Therefore, having a small group session with the community would not be adequate way to promote the risk related of these illnesses. I have chosen the mass approach to provide information to people in large areas but don't belong to a specific group. The mass approach can spread and share this information on mass level, such as city or national broad approach. One disadvantage of this type of promotion is that will not be applicable to everyone who received and viewed this campaign information, which may be reduce the effect this health promotion has on people. Mass media distribution reach a huge number of people. It does so rapidly in platforms such as TV, radio, newspaper, social media. Different resources can be used for health promotion campaigns depending on how it is to be shared and what topic regarding the health promotion is. Resources I would use for health promotion campaigns are social media, poster, using social media platforms, as well as highlighted stories, paper poster to publish in NHS trusts and GPs practices, buses and billboards in crowded city area. As this health promotion is based on raising awareness and encouraging people to make changes in their lifestyle, the best time to release this promotion campaign will be at the beginning of the new year. During the new year, people tend to make resolutions as well as follow other general health promotions such as Dry January. By releasing this promotion at this time, it might be suitable for those looking to make changes for a healthier lifestyle. Duration of this campaign should be longer than usual, as it is essential to highlight the significance of circularity and to making clear links to how anxiety and poor mental health can be risk factor relating to circularity and heart disease. The duration should be around 6 months and conclude at the end of the month of June that same year. My chosen media would be social media and physical billboards, poster with simple recognizable poster that could be viewed both online through social media as well as GP practices and poster billboards. The ecological models include intrapersonal elements which influence behavior such as attitude, beliefs, and personality. Interpersonal elements such as connection with several people provide social support or establishing barriers to interpersonal growth that further healthy behavior. Organizational factors including the rules, policies, regulations, and informal structure that constrain or promote healthy behavior. Community factors such as informal or formal social norms that exist among individuals, organizations, or groups can limit or enhance healthier behaviors. Public policy factors such local, state, and rules and laws that regulates or support health action and practices for illnesses prevention such early detection, control, and management. Example of ecological model: heart. Heart Education Awareness Research Team, disease prevention and health promoting programs to address cardiovascular disease risk factor. Colorectal Cancer Control Program, CRCCP, was designed to address multiple factors of influence on colorectal cancer prevention. Summary of the report covers the titles: 2. Health promotion activity, propose of the health promotion activity, the rationale for the proposed activity in relation to health promotion theory, and lastly, the effective of the resource developed for the chosen health promotion activity. Thank you.